There are three main manufacturers of multi-channel general use biofeedback equipment, and the little biofeedback boxes that pick up the information from your sensor lines all are pretty much the same. They have inputs on the front for the sensor lines, and they have an output going from the biofeedback box, which some companies call encoders, into your computer. And again, they all look alike, pretty much. Here's one of them. Here's another. And there's a third. So this is a biofeedback device from a third company. When you're arranging a place to put your biofeedback device, make sure you leave plenty of room for the wires, or you'll wind up with spaghetti like this. And you won't be able to get the wires apart when you're ready to put them on the patient. It'll be very embarrassing. If you look over here, I have a little rack that the sensor wires sit on, so they don't get as tangled as they might otherwise. They'll still get tangled, but not as much. The software for the major biofeedback devices, the general use ones, all works with the same apparent logic to you, to the user. They're very different inside, but the logic is the same. So this is a start screen for one of the systems, and what it's asking you to do is simply choose how you're going to start. So with this one, what we might do is begin by loading a display screen. And they'll give you choices of what to look for. For instance, these are muscle tension screens. And you can go through a series of drop-down menus to find something you want. So for instance, I'm going to bring up a profile screen for us to use later. And then it asks, do you want to start a new session? Or do you want to review one that you already recorded? And we want to start a new one. And what they do is they give you a choice of somebody you already recorded or somebody new. And we're going to start with somebody we recorded in the past. So all we have to do is click OK. And then you get a screen that asks whether the machine has found the biofeedback box, the encoder. And somewhere they're going to tell you whether your battery is any good. So we still have about 40% power in our battery. So that's good enough. And then all we have to do later is press start when we're ready to go. If you look at this other biofeedback machine, it's from a different company, but it has a very similar start screen. Here, you can begin by selecting a client, and again, you have a choice of one you've already recorded, or you could add a new one, and we'll just save some time by selecting somebody we already did. And then we're going to run a session. And it gives you a choice of what machine you're recording from and what kinds of assessments or biofeedback you want to give. And you just press start when you're ready and off you go. and all of these machines automatically take you to the first screen. So what we'll do now is begin by putting sensors on a volunteer and showing you how to use the test screens. So our first volunteer is going to be Maria. Maria, would you come in? Okay, if you would sit over here. Maria's a volunteer. She's not a patient. She's done this before. She knows that she's survived in the past when we've done this. So she's not overly frightened of the wires right now or concerned. But anytime you start putting all kinds of sensors onto somebody that are obviously attached to a computer that's plugged into the wall, the person should worry the first time, or else they're very unusual. You should get worried if you have a patient that's not a little anxious when being hooked up to something like this for the first time. So you're not going to get a normal baseline the first time. So what we're going to begin by doing is putting sensors on her. When you first start to put sensors on somebody, you're going to find you're very distracted. So it's very important to put notes on your sensors of anything that you want to remember. For instance, this unit is for picking up breathing. However, it has the potential to interfere with how a pacemaker works. So put a note on it that says something like, ask if they have a pacemaker, because you'll get distracted when you're doing this and forget. So Maria, do you have a pacemaker?
No.
Okay, good. So we won't stop your heart when we're doing this. It's considered bad form to kill too many patients when you're starting to do biofeedback. If the body count piles up, your clinic or hospital may question whether you should keep your privileges. You also want to put notes on any sensors that aren't connected the way you're used to connecting them. For instance, this set of sensors mounts on someone's wrist to pick up heart rate. The little round discs here are what contact your wrist, and we hold them on with either tape or a special cuff. However, as opposed to any other sensors that are used to pick up an EMG-like signal, you don't use any sensor paste. If you put sensor paste on these, you get to buy a new sensor disc. So put a note on it that says, no gel. If it sounds like I'm being compulsive, you're right, I am. Because people forget. The other thing that you have to do is absolutely compulsively mark your leads for which channel they plug into. For instance, this is probably too small to see, but that's a little D. This comes apart. When you start doing a recording, you have to remember to check that it's firmly plugged in. But if it comes out in the middle, then you don't know what wire goes with what line. And you certainly don't know where to plug it in to the biofeedback device. So make sure that you've got a little D written every place that this can come apart. If you don't do that, you can almost guarantee that it'll come apart in the one place you didn't mark it. And you won't be able to figure it out because 2 or 3 of them will come off at the same time. So let's go ahead and put some sensors onto Mia. By the way, when you're doing biofeedback, you produce a lot of little bits and pieces of waste, and it'll look really ridiculous if you start piling it up on your computer. So one of the best things you can do to look like you really know what you're doing is have a nice little trash can someplace handy. So I'm going to wipe your brow with some rubbing alcohol. Are you allergic to alcohol?
No.
Okay, the reason I need to wipe your brow is there are normal oils on your skin that everybody has, but the oils conduct electricity. If I don't remove them, the electricity will go from one side of your forehead to another instead of through the sensors that I'm going to put on. Does that kind of make sense?
Yes.
So if you would close your eyes for a moment, I'm just going to very gently rub. We're not trying to rub off her skin or anything here. Okay. In the old days, what you would have to do is rub very hard with a cloth or some kind of an abrasive in order to remove the outermost layers of skin so that you could reduce the impedance enough to get a good signal. But we don't have to do that with modern sensors anymore. Now all we have to do is take pre-gelled sensors and I think we're going to start with the other equipment first. We're going to take pre-gelled sensors and somehow find in this mass of spaghetti the sensors we want, which is going to be next to impossible since I was demonstrating for you how you create spaghetti here if you don't have a nice rack. And I actually succeeded in creating spaghetti. So I'll get Maria's help here. Could you hold that? And I'll find the other lead. Okay. Notice all the rest of this is now completely attached. This is absolutely what you do not want to have happen. What we're going to do is snap the sensor leads to the sensors themselves. And you have to hear an actual snapping sound where you don't have a good contact. You always want to snap the leads on first before you put them on the patient to avoid discomfort. Also, if you're snapping the leads onto the forehead, well, you've got a nice bone back there, so there's no problem about being able to put enough pressure on the snap leads. But what if you're going for the abdomen? If you're built like me, then you have about 8 inches of fat to push in before you can get the lead snapped in right. It's uncomfortable and very embarrassing. So we always put them onto the leads first. So now we're going to go ahead and we're going to put the sensors onto Maria. Could you look toward the camera, please? Look the other way. There we go. Now what I'm going to try and do is not have them attached very well. Because what I want to do is demonstrate the check screen. I want to show you how these work when you're trying to find out whether you've got them attached properly. Now what we have here is we have some wires and a mass of spaghetti. And that is exactly what you can expect to have happen. So don't do this. Don't create this. Remember, I'm doing this to show you what happens if you really, really let a mass of garbage occur. When you have a wire, oh, don't worry about it, it's all going to fall continuously because I don't have it set out on a rack. So what we want to do is we want to tape these leads either to the subject or to a chair so that she doesn't have the weight of these wires on her. It's very distracting and uncomfortable to do. So I'm going to tape these onto your shoulder, okay? And this tape doesn't stain. So it's not going to do anything to you. If you look at the computer screen here, this is the first channel of muscle tension. This is the first channel of muscle tension, and this is a test screen. What it's telling you is that for lead A plus and lead A minus, you have a certain amount of impedance. And it's pretty low. What you really want to do is get these bars down into the green range. So what I'm going to do is go ahead and unsnap the reference. And maybe we're not. You see how they both went all the way up? So if both of them are bad, it's the reference. And remember, I told you don't be putting the snap lead on because this gets uncomfortable. Thank you for putting up with that. Now, you should be down, if we're going to do a real recording, in the green range. In other words, these bars should go down a little bit further to right here, and they'll turn green. So we know that although it looks like I did a good job on putting on these sensors, they're not ready for prime time. That's the value of having a sensor check. All that you're going to have to do is see the screen. Okay? When you're getting ready to do a psychophysiological assessment or biofeedback intervention session, you'll find similarities with all the equipment. They'll have some way to tell you, perhaps by a picture like this, of where you plug in your leads. So they'll tell you how to do it. For instance, this is a 12-channel unit which only has 4 plugs going into it. So leads plug into leads which plug into leads. So that's what you're seeing here, is places to plug leads into other leads until you can get up to 12 channels. So each piece of equipment tells you somehow which channel goes with which leads. If you get the wrong leads in the wrong channel, most of the modern biofeedback equipment will give you a warning. They'll say it's the wrong sensor, and it won't work. Many of the newer pieces of biofeedback equipment will flash a warning on the screen if the sensor falls off or if the impedance goes bad. So you'll know that something's happened during your session. So you'll start with some way to test your sensors. After that, you want to check the signals themselves. That's the next place to go. And that'll be a general screen that will show all the different sensors that you're getting ready to record from. So for instance, we only have one channel of muscle tension set, and it's recording right here in red. All we're using this screen for is to see whether the signals look good, the raw signals. We're looking for noise. We're looking for artifacts. So, Maria, go ahead and tense up your forehead a little bit. Let's see what happens. See that? Relax, 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 relax. Okay, go ahead and tense it up again. Let it relax. And what we can see is that the signal is a normal looking signal. There's not any extra noise in it. Right over here is the fast Fourier transformation for the signal. This is showing you where most of the power of the signal is. If most of the power was somewhere around 60 Hertz, that would mean you're picking up mostly noise from the lights. So look at these little lines here that are dancing at the bottom of the screen. That's how much electrical power there is at each of the frequencies we're recording. We're recording in a narrow bandwidth. That's what the N means here. A narrow bandwidth means we're only going from maybe 90 to 200 or 300 Hertz. So you'll only pick up from there. Okay, Maria, go ahead and tense up a little bit so we can see that. Relax, relax. So you see most of the power is not where most of the noise is. So this is probably a safe signal to use. And we would go through that for every signal that we use. After we're sure we have a good signal, we go ahead to an assessment screen. And here's an assessment screen that would show many different parameters that we would have hooked up for. All we're really interested in is EMG-A. So I can light that up by clicking on it. See how I can light up these different things? See the color changing in the background there? So this is the one we're interested in. And I'm going to enlarge that. I'm going to go to a magnifying glass along the side here and enlarge it. So there's the screen that we're interested in. And we can do various things with this screen. For instance, let's say that this is going across too quickly for us. We want more of a history of the tension here. This is now, this is in the past. And let's say that we wanted a solid minute going across. The bottom of the screen right now says we have 30 seconds. So we can simply change that by clicking on one of the buttons about sweep speed. So we just slowed it down a little bit so that we now have a whole minute. We can change the gain here by clicking on various settings. For instance, now it's showing us between 3 and 8 microvolts. She's sitting there averaging 5 or so. The digital readout is right here. Most biofeedback devices will give you a little digital readout. But let's say we know that we're going to do something to make her really react, like I'm going to reach over and tickle her or something so that it'll go up. So it went from 0 to 50. You see how the gain changed automatically when she tensed up? That's because we have automatic gain control on. But we're going to turn that off so that it won't change automatically. Now, if we don't want to have 0 to 100, If we want to go back to 0 to 8, then we would use this control right here, which is showing big to small or small to big. We want the screen to show less microvolts on the screen. In other words, it's magnifying. So we're going to go like this. See how it went now? Instead of 0 to 100, now it's 0 to 50. We could go 0 to 20 so that we could see it more when she's relaxed. But of course, if we reach over to tickle her, go ahead and tense up. Tickle, 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 tickle. It goes right off the screen. So that's no good. That's not the correct gain setting. So what I've showed you how to do is control sweep speed and gain. Okay, Maria, just relax. Just let yourself relax. Just let your eyes relax. Let your forehead relax. Let your jaw open a little bit. If you want, just close your eyes. Just let yourself relax. So why isn't she coming down? She's attending to the screen. She's staring at it from an angle. And she's already pretty relaxed. On this device, normal is between 0 and 2 or so. So if she sits here and relaxes and doesn't have her head twisted to the side, if we had her looking right at the machine, this would eventually go down. She will work on that and get it down on her own. You see how she's already below 4? Okay, so just let yourself relax and it'll go down. And we're going to switch to another machine to show you some other characteristics of how to do biofeedback. You're on. I'm going to show you some other characteristics of what you can do with a biofeedback recording. So we're switching machines now. I'm going to put a similar set of sensors on Maria. So remember, normally we wouldn't be doing this. We would have put the snap leads on first before we put them on the subject. Once again, we want to show a little consideration for the subject by taping these sensors out of the way. And if the subject is going to be moving around, we would simply tape the sensors to the subject instead of to the chair. Always remember to check that the wires are plugged in properly, because if they come loose, you may not know it. Okay, so are you comfortable, Maria?
Yes.
So what we're going to do is we're going to load a display screen, and what we're going to do here is pick up screens that are for muscle tension, and we're going to choose one that's for one channel. We're going to choose one that's for one channel of muscle tension. We'll load it, and it gives us the choice of starting new or reviewing something we already recorded. We want to start new, and this is still Maria. So we're going to select Maria. Thankfully, the computer and the biofeedback device have found each other, and we have plenty of battery juice, so we can go ahead and start. I have a sound on. Maria, go back, let yourself relax. Anytime she gets down too low, below this line, the sound's going to go on. So we're giving audio feedback, really annoying audio feedback. So she'll stay tenser than that line. This line is a threshold line. What we can do is change the level of it. So you see it going down there? So let's say that we wanted Maria to stay above that line. Go ahead, we're training you to stay above the line so there's no noise, okay? So you can do that very well. Or let's say you actually like that noise and we want you to relax so that the noise goes on. So keep that noise playing all the time, okay? And you can see the screen all right from there, right? Okay, keep the noise on. Now she's doing very well, so I'm going to lower the threshold a little more. So you notice what she's doing. Before she could barely get down to threshold, but I lowered the threshold and she's still getting down to it successfully. So she's using that as a tool to learn and is doing quite well. So this is biofeedback with a threshold. Another aspect of recording that we can change is the position of the signal on the screen. For instance, the signal here is down near the bottom of the screen. Let's say we wanted it up in the middle. Notice that we're recording from 1 to 21 microvolts, so that's a range of 20 microvolts. If we use offset controls that move the signal up and down, the signal will change on the screen. See it moving? We still have a range of 20 microvolts, so we didn't change that. What we moved was the location of the signal from down here to up here. There was no change in gain. We merely moved where the signal is on the screen so that you can see the variability more, so that if Maria were to relax, it wouldn't go off the bottom of the screen. So the offset control is very powerful for putting the signal where you can see it. Ready to take the sensors off now, but these are a lot more stickier than most Band-Aids. So they could hurt when it comes off, especially if you're working with a man with a very hairy back and you've got the sensors on the back. You don't want to cause your client to be uncomfortable because they might not come back. So what we're going to do is use something that looks just like an alcohol pad. This is called Unisolve. And you open it just like an alcohol pad, and you put it underneath the part of the sensor that has a glue-free area, and just rub it right down, and all the hair and everything comes loose, and there's absolutely no pain. So again, this is really much nicer for your subject, and they're much more likely to come back. And if it's a large male with a hairy back, they're a lot less likely to turn around and slug you as you're doing this. Okay, thanks very much, Maria.